If you have been told that you have type 2 diabetes, prediabetes, insulin resistance, or even just a slightly elevated A1C, chances are that most of what you heard was just focused on your blood sugar. And that is very important, of course. But there is another issue that often flies under the radar when we're talking about blood glucose, and that is your heart. People with diabetes are 2 to 4 times more likely to have a heart attack or stroke than those without it. What is even more concerning is that this increased risk starts long before you are ever diagnosed. It can begin during those early years of insulin resistance, while your A1C is still considered normal, and long before any symptoms develop. And yet most people have never been told that their cardiovascular system is quietly under threat. This video is for anyone who has been told that their blood sugar is a little high. Maybe your doctor has mentioned prediabetes in passing. Maybe you have struggled with weight or have a family history of diabetes. Or maybe you're just trying to manage it now and just want to avoid the complications that come down the road. Regardless of where you are in your journey, this is the piece that is so often missing from the conversation. Hi, I'm Valerie, a registered nurse and health educator. My goal in creating these videos is to close the massive education gap between what the most recent science tells us and what patients are actually told. Sadly, the healthcare system is not designed to give your provider the time that they need to let you know what is really going on inside your body. But that does not mean that you should not have access to that information. So let's talk about what is happening to your heart when you have insulin resistance, prediabetes, or diabetes, and more importantly, what you can do about it. It helps to start with understanding insulin resistance because this is the root problem in most cases of prediabetes and type 2 diabetes. And it is also one of the earliest signs that your cardiovascular system is under stress. When your body becomes resistant to insulin, your pancreas works harder to produce more of it. Over time, that creates a high insulin environment in the body that promotes weight gain, increases blood pressure, and disrupts how fat is stored, particularly around the organs, something that is called visceral fat. Additionally, your blood vessels start to be affected at the structural level. Insulin resistance contributes to something called endothelial dysfunction, which is when the inner lining of your arteries don't function properly. That lining is responsible for regulating blood flow, keeping your blood pressure stable, and helping your blood vessels dilate and contract as needed. When it stops working correctly, everything from blood pressure regulation to clot prevention is disrupted. This dysfunction makes it easier for plaque to build up in the arteries and harder for your body to recover when damage does occur. At the same time, higher levels of insulin and blood sugar also lead to oxidative stress and increased inflammation, which are two of the most damaging forces when it comes to heart health. This damage does not wait for your A1C to hit a certain number to occur. It starts years earlier, during the years when your labs are maybe just slightly elevated and you're told to keep an eye on it, but not given much more direction other than that. So let's talk a bit more about inflammation and oxidative stress because many people do not realize the massive impact that they have on heart health. Oxidative stress happens when there is an imbalance between free radicals and your body's ability to neutralize them with antioxidants. Free radicals are basically unstable molecules in the body that cause damage to other essential molecules like DNA, proteins, and lipids. They potentially increase the risk of chronic diseases and contribute to the aging process. Chronically high blood sugar leads to more free radical production. Over time, these free radicals cause damage at the cellular level. And then there is also chronic inflammation. Now, we're not talking about the kind of inflammation you get like with a sprained ankle like I have right now. This is a low-grade systemic inflammation that your immune system maintains in response to things like stress, poor diet, lack of sleep, high blood sugar, and insulin resistance. It contributes to the formation of plaque in your arteries. It worsens blood pressure control, and it interferes with how your cells respond to insulin. The combination of oxidative stress and inflammation accelerates the process of atherosclerosis, which is the buildup of plaque in the arteries. And this can lead to heart attacks and stroke. And once again, this process starts quietly and slowly, long before you feel any obvious symptoms. Sometimes even a heart attack doesn't come with clear symptoms in someone with diabetes. Because of nerve damage related to chronically high blood sugar, they may not feel the classic chest pain. That is why silent damage is so important to address early. One of the biggest misconceptions is that this is all about weight. I think a lot of people think that only those who are overweight need to worry about prediabetes and diabetes. While excess visceral fat, which is the kind that collects around the organs, does increase risk, there are plenty of people at a normal weight who are still insulin resistant and still at risk for cardiovascular complications. We need to look at other underlying markers like blood pressure, triglycerides, HDL, inflammatory markers like CRP, and the waist to hip ratio. A person can appear healthy on the outside but have a lot of silent risk factors under the surface. This is why a lifestyle change is important for anyone at risk, regardless of the number on the scale. Now, here is where this video gets encouraging. The same lifestyle changes that help with blood sugar also help protect the heart, and for reasons that go beyond weight loss. So, for example, when you start increasing your vegetable intake, well, first off, you're going to end up eating fewer processed foods that cause sugar spikes. But on top of that, you will also be taking in antioxidants that help reduce the oxidative stress caused by those free radicals that I talked about earlier. Additionally, you are taking in fiber that supports your gut and lowers inflammation that way, too. Vegetables also provide compounds that help regulate blood pressure and cholesterol and fight inflammation in other ways. Vegetables are one of the most underutilized tools that we have for heart disease prevention. I know that this might sound a bit cliched, but eat those veggies. And if you start your meal with a small salad dressed in olive oil and vinegar, you are actually layering in multiple strategies at once. The fiber in the vegetables helps slow digestion, which means glucose enters your bloodstream more gradually. That alone helps reduce the size of the blood sugar spike that can follow a meal. The olive oil provides healthy fats that support insulin sensitivity and heart health, and the vinegar contains acetic acid, which has been shown in research to blunt post-meal glucose and insulin levels. And there's another benefit here. Starting your meal with something slow and nutrient-dense gives your body a chance to release satiety hormones, which are the hormones that tell your brain that you have had enough to eat. It can take those signals up to 20 minutes or more to register that you are full. So when you lead into your meal with something like a salad, you are pacing the meal in a way that supports those natural signals. You may end up eating less overall and feel more satisfied afterward because your body had the time it needed to communicate clearly that it is full. Movement is another powerful tool. This can be very simple. Movement after meals, even just a 10-minute walk after meals, can significantly lower post-meal blood sugar. It helps glucose move into the muscles instead of staying in the bloodstream, reduces the insulin burden on the body, and improves endothelial function, which protects your blood vessels. This is a great habit to start with if you want to improve your metabolic health and reduce your cardiovascular risk. Along with that, the total amount of movement that you get throughout the day is also important. Long stretches of sitting, especially more than 6 to 8 hours a day, has been linked to higher blood sugar, more insulin resistance, and a greater risk of heart disease, even in people who do get in some regular exercise. So this really comes down to moving more and sitting less consistently. Getting up every hour, walking between tasks, stretching, doing a few squats. Small breaks like these in sedentary time can make a measurable difference. Strength training has unique benefits too. Muscle tissue is one of the most insulin sensitive parts of the body. The more you have and the more you use it, the better your glucose regulation will be. Strength training also reduces inflammation and improves cholesterol levels. And again, this does not have to be overcomplicated. Simple exercises like resistant bands, simple body weight movements, or light weights can all add up. And of course, it is also important to pay attention to sleep and stress. Lack of sleep increases cortisol, worsens insulin resistance, and increases inflammatory markers. Chronic stress does the same. Both are real biological drivers of metabolic and cardiovascular disease. So, if you have been focused only on managing your blood sugar, or if you've been told that you were at a risk but haven't really been told what to do, I hope this video gives you a deeper understanding of what is really at play. I am not putting this out there to scare anyone, but I do want to give you the knowledge that can empower you to take action early. Because it is not just about lowering a number on a lab report. It is about protecting your heart, your brain, your circulation, and your quality of life for years to come. If you were looking for practical ways to take that next step, check out my guide called Tiny Habits for Heart Health. This is a downloadable PDF packed with small science-backed actions that support both your heart and blood sugar, and also shows you how to successfully build these habits into your life, even if you have struggled with making changes in the past. I'll be putting a link to that in the video description. You can also find a summary of this video in the free version of my Patreon membership, as well as a more detailed, deeper dive into diabetes, heart disease, and how lifestyle can protect you in any one of my paid tiers or as a one-time purchase. I will link to that as well. I also want to mention that there are many structured diabetes management programs out there now, and I am impressed by what some of them offer. These are usually based on a monthly subscription and can help you bridge the gap between medical advice and real-life implementation by providing personalized guidance, accountability, and the latest tools like continuous glucose monitoring. One of these is called Healed. I can't speak much about the quality of their program versus others, but I can give you a 10% off coupon code if you want to check it out. And I'll put more information on that in the video description as well. If you got some useful information from this video, please give it a like and let me know your thoughts in the comments section. Please also feel free to share with someone who might also benefit from it. Help me spread the word. I share science-based videos here on this channel, all designed to fill the knowledge gap so many people have about their health. My goal is to make complex topics easier to understand so you can make informed decisions and take more control over your health. If that is something that you want more of, please consider subscribing and feel free to explore some of the other videos that I have posted. There's a lot more that we can do for our health and longevity when we are well informed. Thank you so much for watching, and as always, please take good care of yourself.